Hello, and welcome to my presentation on the ethics of machine learning in the U.S. foster care system. My name is Alyssa Clark, and this presentation is part of my Data Science Ethics Capstone project, which is course DTSC 690, Section 80 at Eastern University, and I'm happy to be with you today. To help define the scope for this ethical issue, I have some summary statistics here to establish the prevalence of foster care in the United States. As you can see, about half of children exit care each year through a combination of reunification, adoption, or aging out as a legal orphan. Turning toward that other half of children, of those, approximately one-third are termed legally free, meaning parental rights have been terminated to those children and they are waiting to be adopted. For the purpose of this presentation, I am generally honing in on that legally free category or children earlier in the process who are likely to become legally free as part of their foster care journey, where they can wait months or even years hoping for adoption, and how machine learning is not only ethically permissible, but ethically necessary in assisting these youth. To answer why it is ethically necessary lies in privacy concerns. Here, we have a timeline for a child interacting with the child welfare system, including the foster care system. It starts here, at birth. A child is born into a specific combination of class, status, race, location, and political climate. Certain data gathering is appropriate if the child is in a purely publicly funded environment or the parents give explicit consent for data collection in exchange for some incentive. Typically, that incentive is citizenship for the child as notarized by a social security number for tax purposes. Then an initial CPS report is made and data is gathered specific to that child and that child's family. The worker receiving this call out of the 4.276 million calls made annually to CPS must determine next steps. Does this call for this specific child warrant investigation? Data from similar cases may help inform investigative actions, especially cases that began similarly and resulted in significant interventions such as out of home care or termination of parental rights. Finally, a CPS case is considered founded and a parenting plan created. Remember, the first goal of foster care is always reunification. So a parenting plan is created and the child is removed from the home. Detailed data on various interventions is gathered, and by aggregating that information, it can be processed to help inform future interventions and suggest support services. In some cases, the child is never returned to their home of origin. As you can see, once a child enters foster care, that child consistently suffers significant privacy loss in an effort to ensure that child's safety. This is a system that, by its definition, must invade privacy in order to work, in order to ensure that that child is safe. To illustrate, from my personal lived experience as a foster parent, here's a typical foster care team roster for a school-age child living in foster care. On any one email, there can be 10 to 14 appropriate team members to loop in. The updates are endless, and many usually private matters that are discussed only between parents and perhaps a doctor or a therapist must become team meetings. This is to first protect children from additional abuse, which is unfortunately sometimes found within the foster home environment. And secondly, to inform all interventions provided by the various team members who are frequently offering behavioral and mental health supports. As machine learning algorithms have the advantage of anonymizing and aggregating data in making decisions, they are certainly no more privacy invasive than the current system. However, extensive use of the machine learning, in the foster care system has benefits that the current system does not. Those include first, screening for additional benefits and services that the child is eligible for. Laws, regulations, and supplementary programs through public and private sources are endless and expanding. The administrative burden for screening for additional resources is something an algorithm could do. Second, machine learning models can also predict the success for specific interventions for a specific population of children. Observing trends along racial, socioeconomic, geographical, and medical diagnosis lines help inform whether a child will benefit more from, for example, cognitive behavioral therapy or trust-based relational interaction. Perhaps best of all, appealing to the results of a machine learning model can help temper the effects of one highly opinionated team member. This is an invaluable support for foster children. One disillusioned major team member can cause much damage due to the amount of control they have over the child's life. Likewise, a single inexperienced team member working in a notoriously underpaid, overworked environment may not always have all the resources to make excellent decisions. Machine learning can help us bridge these three gaps as a society to help protect the most vulnerable subpopulation of children in the United States in ways that assist foster children to retain dignity through increased personal privacy. To the extent that machine learning models use private information in limited ways, are deliberately designed with human bias in mind, and work under human oversight, they fulfill an incredibly important need for society, which will receive these foster youth into adulthood within a few short years. There are three major areas of screening, which correspond to the levels of privacy timeline discussed earlier. Here, I have provided two examples of work being done in those areas. The third, permanency planning, is under investigated, but I recommend it as a general area of exploration for interested parties interested in conducting that research. In the first section, where general screening is performed, public health agencies can use their data to determine preventative intervention. Having niche geographic and microsocial climate awareness is key. Predicting the best location for a town's AA program, a new drug rehab facility, or even the location of libraries and parks can have significant positive impact on child welfare in that area, especially for the most vulnerable children, those at the greatest risk of entering foster care or are currently in foster care. The next layer of screening, as well the child's case, is in CPS processing. This project cited here is an excellent example of government agency partnering with a university to give their specific county cutting edge technology to determine which CPS cases are most likely to need extensive family interventions, including out of home placement. and encapsulating it into an easy-to-use interface. I highly recommend this study for further review for anybody who thinks that they will be working in a partnership with any sort of a governmental agency or interested at all in how machine learning can be applied in the social services industry. There's also work being done using text mining to predict the likelihood of family substance abuse in the home based on caseworker free text report after the CPS investigation has occurred, and additional text mining work screening for child abuse based on free text in healthcare provider notes. Note on that last project with the healthcare data, I consider this as a counterexample to ethical machine learning in the child welfare context, as it relies on the gathering of general population notes, which is privacy invasive. Even though the intent is good, I don't consider that precise project an ethical use of machine learning, as it is not less invasive than the current standard of locating abused or neglected children, which relies on healthcare providers and other mandatory reporters and concerned citizens to file a CPS report. That being said, that particular study was conducted in the Netherlands, and ethics around privacy are very culturally dependent. So while I don't consider that an ethical use here in the United States with our culture, it could be extremely ethical in the cultural context of the Netherlands. I am not a sociologist, so I won't elaborate further on that particular study. These examples demonstrate how machine learning can have a really significant positive impact that can improve the screening quality and, by extension, improve child welfare outcomes. A lesser researched item is predicting best interventions for a particular child. Well, no single algorithm or even collection of algorithms can ever give perfect recommendations. It can grant insight into where to place very limited resources. In this example study, the focus was on identifying the youth most likely to age out of foster care into legal orphan status, which is closely associated with negative long-term repercussions for that child as they enter adulthood, and with the intent to prioritize those youth for the most extensive interventions designed to prepare them for adulthood and for healthy future relationships in the absence of parental support. This machine learning model invites further questions and exploration into preventing youth from aging out and providing quality support to them when they do. Suggested items for research for this area include comparing intervention success based off multiple independent variables, identifying interventions most likely to overcome racial disparity in intervention success, and exploring the relationship between number of foster placements and success of specific interventions. To summarize, machine learning is an effective ethical tool to use in the U.S. foster care system, which has substantial contributions to make in screening for interventions, predicting success for interventions, and mitigating the bias of individual team members. To the extent that machine learning algorithms accomplish these goals while gathering data in privacy protecting ways, operating with human oversight, and undergoing industry standard bias adjustments to normalize data, machine learning is used ethically in this environment. Thank you for listening to my presentation. I hope it has been informative and enjoyable, and that you have learned more about how machine learning can be used in this underserved industry. Thank you.